Hi, my name is Dr. Zachary, and I am the developer of the Handmaster Plus hand exercise system. And recently I've been getting a lot of questions pertaining to carpal tunnel syndrome, questions about different types of passive treatments, some of the passive treatments involving ice and heat, but also as well as kinesiotaping and the likes, and supportive braces. And one thing that I can tell you, I'm a strong believer that anything that does reduce the symptoms will help to get you on that functional path, but at some stage we have to address the mechanics of what's going on and causing the carpal tunnel syndrome. Carpal tunnel syndrome has almost become just a cliche term of a symptom, and we forget that it can be very complicated, and it needs a skilled practitioner to see what's going on. The carpal tunnel syndrome is basically a nerve entrapment of the median nerve, and that entrapment can happen at the common place where it's considered at the wrist, at the carpal tunnel itself. It can also be in the flexor superficialis muscle. It can get trapped underneath, and also underneath the pronator teres muscle. So we have to take carpal tunnel syndrome seriously when you do have that symptom, and have a skilled practitioner look to see where it's coming from. The idea that we can just across the board tape one area and keep the carpal tunnel spread, which again I have no problem with that idea, but that's not the only cause of it, and we can't simplify it, or we're going to be chasing the symptom around. Again, the symptom is one thing, but to restore the mechanics, at some point we're going to have to restore the mechanics, and at some point we have to take seriously about addressing the mechanics. For instance, if we work with our hands in our sport, in our creative activity, we have to keep the muscles of the hand, wrist, forearm, and elbow strong and balanced, and we have to establish good blood flow, or we can't expect not to have a cumulative trauma disorder at some point. So let's try to remember that carpal tunnel syndrome is an end product. It's a condition that's caused by imbalance. So merely trying to address the symptoms, yes, if we reduce the symptoms, of course that is good for anybody experiencing it, but if we take it very seriously, that we prepare our body for our activity and keep our hands, wrists, forearms, and elbows strong and in balance, that is the ultimate situation you want your body to be in, so that you can perform maximally, and so that injury is a very unlikely possibility. I'll go through really quickly what we designed the Handmaster Plus to be a very convenient and simple exercise, but yet a complete exercise and an affordable exercise. Very simply, what we can do is, if we work with our hands, wrists, forearms on a regular basis, and many people do in their workplace, in their sport, in their kind of craft environment, or in their musical pursuits, for example, we need to strengthen all the muscles. Now, 9 muscles close the hand, 9 muscles open and spread the hand, and if we keep those muscles strong and in balance, situations like carpal tunnel syndrome, it's going to be so unlikely that ever can come up. But more importantly is that we are now preparing our body properly for the maximal performance. So I'm just going to show you, this is a Handmaster Plus. I've put it on. It's just a cord that goes onto the fingers, and what we're going to do is we're going to keep our wrists straight. We're going to very simply squeeze against the resistance of the ball for a count of 1, and then we're going to open and spread for a count of 1. Okay? It's very simple. Instead of showing a patient 4 or 5 different exercises, you just close your hand against resistance, open and spread your hand against resistance, just like that. Okay? Continue until a comfortable fatigue. That shouldn't take you any more than 30 seconds to a minute. Close, open, and spread. Close, open, and spread. I strengthen all the muscles of the hand. I also keep the hand moving through a full range of motion, so I'm going to establish maximum blood flow, which is another key thing in preventing carpal tunnel syndrome. Okay? Very simple exercise. Anybody can do it at your breaks, or you can carry it along with you if you're an athlete or a musician. You can just have it on your desktop if you do work in the workplace. And carpal tunnel syndrome, again, now that we have the muscles on the outside of the forearm, hand, wrist, and forearm, balanced with the muscles on the inside of the hand, wrist, and forearm, carpal tunnel is highly, highly unlikely. and we will address the mechanics of the hand properly in preparation for our pursuit. To see the Handmaster Plus, you can go to our website at www.doczac.com. That's DOCZAC.com, and there's lots more information about the product.